Good evening, everybody. This is Shakira Cabasquini here to talk to you with our next community health announcement, and we're going to be discussing contraception more so and more identifying subdermal implants. Um, a lot of individuals aren't aware that there are so many types of contraception, and also, a lot of people aren't aware that there's contraception that doesn't need to be like ingested orally or inserted through your uterus or injected. There's this thing called subdermal implants that are also a form of contraception and help uh, to negate the unwanted pregnancy. So as usual, we're going to start with a pre-test. First question is, what is contraception? What is the definition of contraception? What is it? Why is contraception used? Once you figure out what the definition is, the next question most people may have is, why is it used? What are some types of contraception out there available on the market to females to help them with, not wanting to be pregnant. And then the final question is, why choose subdermal implants in unwanted pregnancy prevention? You know, what, why would somebody use this form of contraception as a go-to as opposed to others that are out there? So, what is contraception? Contraception are methods or techniques used to prevent pregnancy. Um, the most common form of contraception that most people are aware of is condom use. Um, that is a go-to that has been there since the beginning, I guess, or since condoms have been invented. They're easy, they're accessible. You can buy them from the store. It's not something you have to do daily. It's something that you can use when the act of sex is about to take place. Um, Contraception is a form of birth control, which means, helps control the rate at which people get pregnant. Different forms of contraception include oral contraception, intrauterine devices, subdermal implant devices, and condoms, just to name a few. There are others out there. The use of contraception is indicated in the prevention of sexually active individuals of unwanted or unplanned pregnancies. All right, so we're going to go into the different examples of contraception that were earlier mentioned. Oral contraception are pills that are to be taken daily as directed for efficacy, meaning for the affected use, or the affected um, wanted outcome. When taken effectively, they are 99% effective in preventing pregnancy. IUDs, or intrauterine devices, are inserted into the uterus via the cervix and left in place for a directed amount of time. That could be 3, 5, or 10 years, according to the type of IUD. An IUD does not require daily maintenance and is also 99% effective. It is one of the go-tos that most people look to because it's one of those things that once it's in place, you don't have to worry about. Subdermal implants are devices placed under the skin of the non-dominant upper arm above the elbow crease. SDIs, or subdermal implants, the placement has been proven to be once placed, has been proven to be over 99% effective. So far, subdermal implants are more effective in preventing pregnancy than any other contraception. Some examples of oral contraception are orthotricycline, Alise, or low estrogen FE. IUD examples are the Paragard, the Mirena, or the Skyla. And subdermal implants examples are the Nexplanon, the Implanon, or the Norplant. Okay, so some subdermal contraceptive implants as a choice. It's safe and highly effective due to subdermal implants being highly effective. It has been studied to be a top choice of contraception in adolescent teenagers. It's a very reliable source of contraception without daily responsibility or the discomfort of insertion through the pelvis at insertion time. Um, One of the things that contraception do help prevent overall is teenage pregnancies. Teenage pregnancies can lead to low education attainment, unemployment, poverty, and health um, disparities like eclampsia, preterm delivery, low birth weight, and neonatal complications. Some cons to subdermal contraception. There is the idea of abnormal bleeding. It's one of the most reported side effects and reason for discontinuation of the implanted contraception, unfortunately. Another is a fracture of the device, which can be due to direct physical impact at the site, or it can be unrelated. Unfortunately, like all other contraception, um, it does not prevent the contraction or spread of sexually transmitted diseases. We all know that abstinence or safe sex with condoms is the best way to do that, or having one partner. Sticking with one partner is the only short way if you're sexually active to ensure that you're not transmitting any sexual diseases. And the last one is weight gain. Weight gain is a side effect attached to a lot of contraception use, but it should not be a deterrent. So here's some pros to subdermal contraception. Subdermal contraception does not require parental consent, according to Kumar and Brown. That was an interesting thing I read in one of the studies. Um, it's not something that if you, as an underage person, decide that you want contraception and you want to go forward with it, you do not need your parent involved in order for you to get this type of contraception. Contraception, like other long-acting reversible contraceptives, this one, subdermal contraception, has low risk indications for people with other health issues like deep vein thrombosis, pulmonary embolism, hypertension, lupus, heart disease, and seizure disorders. It doesn't have any indications of not using it. And then the last one is the use of contraception, such as subdermal contraceptive implants, lowers overall health service costs, which is a good thing for you and your community as a whole. So here's some more reasons to promote subdermal implantation as a contraception use. Um, the convenience, the ability to inhibit pregnancy without a daily care. You don't have to worry about it every day. Once it's in, it's in. And until you're ready for it to come out or it's hit its lifespan, you don't have to worry about it. The best part is there's no parental consent if you are not at the age where you can cover yourself, you're not 18 or over. They're proven to be the most effective form of contraception because they are over 99%, not just 99%, but over that. And the Affordable Health Care Act has mandated that all contraception, just like the subdermal contraception, should be available to all individuals at no cost or co-pays. So the issue or barrier of finances or ability to pay is not there anymore. It's available to anybody who wants it. So that was the end of my presentation. We're now at my post test. I'm gonna go back to those questions. What is contraception? It's methods or techniques used to prevent pregnancy. Why is contraception used? It's used to, again, prevent the occurrence of unwanted pregnancies. What are some types of contraception? There's oral contraception, intrauterine devices, and subdermal implanted devices, along with condoms. And then last but not least, why choose subdermal implants in unwanted pregnancy prevention? Subdermal implants have been proven to be over 99% effective in prevention of pregnancy. They do not require parental consent. They lower overall healthcare costs, and they decrease the negative life outcomes. So, in a nutshell, it seems like a good reason to go with this form of contraception. Check out my references, and I hope you enjoyed.